Hi, my name is Kate Feibusch and I'm a physician at Kaiser Santa Rosa. The Sonoma County coronavirus epidemic is changing quickly and there's information coming at you from a lot of different sources. We understand that this can be overwhelming and stressful, especially if you're trying to figure out how to care for someone in your house who's sick. This video is about self-isolation, which are the rules that you need to follow if someone in your house has been diagnosed with COVID-19 infection or has been told that they might have COVID-19 infection. And you need to follow these rules to help prevent the virus from infecting other people in the household and people outside the household. So the first thing to do is realize that these rules have to apply to everyone in the house. The most important thing that you can do is stay home. And please don't have any visitors come into the home. Friends and family who live outside the home can help you by doing grocery shopping and doing other errands, but they should leave the packages on the porch. If they do need to talk at the door, they should stay 6 feet back. This is what we need to do to keep the virus from spreading outside of the household. If they can't have a room to themselves, then they should wear a face covering or a mask and try to stay 6 feet away from anyone else in the house. The masks should be changed every day, and if they become wet or soiled. Remember, the masks themselves have a lot of virus on them, so you want to use disposable gloves if you can, and wash your hands afterwards in any case. Anytime you touch something that the person who's sick has touched, you want to use gloves if you have them and wash your hands afterwards. This applies to dishes, laundry, and trash. We think that used tissues might have a lot of virus on them, so you'll want to be particularly careful about putting them in plastic bags and tying them up for disposal. The virus stays in the air for several hours, and so keep the windows open as much as you can and let fresh air in. If you do have to share a bathroom, then it should be cleaned after the person who's sick has used it and before it's used by anyone else. Try to wait as long as possible before cleaning it to let the virus settle out of the air. Disinfect all of the surfaces with a diluted bleach solution or another household disinfectant. Pay special attention to the high-touch areas like the faucets and the doorknobs. Follow the instructions on the label of the household cleaner so that you make sure that you're using it safely and effectively. Disinfect all the high-touch areas of the house every day. That includes things like the remote control, doorknobs, faucets, banisters, and counters. The sick person's laundry can be mixed with everyone else's laundry because the washing process kills the virus. But you want to make sure that you don't shake out the dirty laundry because you don't want to get virus up into the air. Wash the clothes with the hottest water that your clothes will tolerate, and for extra security, you want to dry them completely. Everyone in the house should be monitored for symptoms of infection like fever, cough, and fatigue. And if you have any of those symptoms, you should contact your healthcare provider. Of course, if you're having a medical emergency, you should call 911. Symptoms of a medical emergency might be difficulty breathing, chest pain, confusion, which might be caused by a lack of oxygen to the brain, and a blue tinge to the lips, which could be caused by not enough oxygen in the blood. If you'd like more information, there's a lot of good information on the CDC's COVID-19 webpage called What to Do If You're Sick. Doing these things will help keep you and others safe and healthy. We're all in this together, and we're all going to get through it together as well.